Okay, so let's continue our discussion of Tim O'Brien's The Things They Carried from this perspective of trauma writing. And before we go on to specific examples in the text where I think there's evidence of post-traumatic stress disorder, uh, let's take a little look at exactly what I mean when I say post-traumatic stress disorder. So let's get a proper medical definition that we can use as sort of the background information for our discussion of these stories. So probably the best place to look for a medical definition of post-traumatic stress disorder would be from the DSM-5. So this is the diagnostic criteria that is used to diagnose post-traumatic stress disorder. So in this definition, we have trauma being defined. So it refers to a person who is exposed to death, threatened by death, actual or threatened serious injury, or actual or threatened sexual violence. And this includes direct exposure, witnessing, indirectly as well, if you witnessed or if you learned about a close friend or family member who was exposed to violence, sexual violence, and repeated indirect exposure as well. So if you were a medic or first responder in a traumatic situation, you might also have this repeated exposure causing post-traumatic stress symptoms in your life. So if we scroll down, part of the diagnosis is in the presence of certain symptoms. So recurrent, involuntary, and intrusive memories is one of the sort of telltale symptoms of post-traumatic stress. So memories that are replaying in one's mind, relived involuntarily, right? So you don't have any choice, but you have these maybe recurring memories or nightmares. Nightmares, flashbacks, and blacking out, and those types of things that cause you to relive or reenact events of the past that were particularly traumatic. And avoidance is another one. So avoiding any avoidance of distressing trauma-related stimuli after the event. So if you are, say, traumatized by an accident, maybe you would avoid the behavior of driving in a car again. Or, you have a resurgence of feelings, anxiety, if you are reminded of that event. And generally you avoid exposing yourself to anything that will remind you of that experience. Negative alterations in cognitions and moods. So you could have gaps, inabilities to recall certain parts of that event. So there are certain sort of blind spots or gaps in your memory because it's repressed content and you don't want to bring it forth again. So persistent and often distorted negative beliefs and expectations about oneself or the world. So you could feel a sense of guilt, depression, sadness, blame, self-blame. So you think you didn't do enough. You wish you could go back and do that event over again and do it a different way. Fear, horror, anger, guilt, shame, all these emotions are part of post-traumatic stress disorder. There might be a marked alienating oneself, isolating oneself from one's previous relationships, feeling like you no longer fit in anymore with society or with your friends, with your family. So you sort of estrange yourself or detach yourself from any relationships. Inability to experience positive emotions. So you can no longer enjoy life. And here we have alterations in arousal and reactivity. So you might experience this post-traumatic stress disorder, self-destructive or reckless behavior. So somebody taking unnecessary risks with their lives, almost like Freudian's death drive, right? So you're sort of driven by a kind of negative life force where you almost are reckless with your life. Aggression, hypervigilance, exaggerated startle response, problems in concentration, sleep disturbance. So all other sort of behaviors associated with post-traumatic stress. Other ones could be hard time functioning in your normal routine. Substance abuse is another one. So alcohol abuse, drug abuse, as a way sort of coping with something traumatic in your life. This idea of dissociation is also prevalent in post-traumatic stress symptoms. So the feeling of being sort of split or detached even from oneself, trying to divide yourself or feeling divided, feeling like life is not real or you have some sort of two halves of yourself. So these are just some characteristics that are prevalent in post-traumatic stress disorder. So with these in mind, let's take a look more closely at some of the traumatic events that take place in Tim O'Brien's stories. So there are many instances where characters in the book deal directly with loss and death. We already talked about the character of Jimmy Cross, the first lieutenant of the Alpha Company, who in the very first title story of the book has to deal with this reality of losing one of his men, Ted Lavender. He'll also deal with the loss of other members of his troop, his company, who also die. And how to tell a true war story. So this is another, probably one of the more important narratives in this book. We have the character of Rat Kiley. His real name is Bob. He's the medic, but everyone calls him Rat. And he is dealing with the death of his very good friend, Kurt Lemon. And we get to see how Rat Kiley reacts to this death in a very brutal killing of a baby water buffalo, which is, I don't know if you agree with me, but this is probably one of the hardest stories to read in this book. Very gruesome. And, you know, makes me feel sad and angry all at the same time. So it's a tough read, that one. Another instance where Tim O'Brien, so he talks about his own experience of when he is responsible for the death of a Vietnamese man. And he'll think about this moment, and it becomes something that sort of haunts him in a way. His daughter will ask him about whether or not he's killed somebody, and she's too young that he can't answer her truthfully, but it's something that stays with him, and he sort of has this narrative. So in The Man I Killed, he sort of reflects on this young man's life that he is responsible for taking, and imagines what kind of life this young man led up to this point. He even goes so far as to imagine, what would have happened had this young man not have lost his life in that moment. So there are some also similarities drawn. So just in his story, in that story, he sort of uh, deconstructs this idea of self and other by saying there are similarities between himself and this man that he has killed in combat. So he's dealing with that reality, the actually being the person who kills somebody, and that is also kind of a traumatic moment in the text. And as far as post-traumatic stress disorder, I think we'd have to say that Norman Boker, there's two stories, Speaking of Courage, and then the second story after that is Notes. Both of those sort of chronicle the character of Norman Boker and how he deals or is incapable of readjusting to civilian life, and deals with what happens to a war veteran after the war, right? How is he able to readjust and return to the life that they are no longer feel sort of a part of. So once you return home after your tour of duty, you're no longer, it seems like, the same person you were before, and there's seems to be a sort of lack of support for this character. So we learn about his tragic circumstances, and I'll talk more specifically about these stories in a moment, but just for now, if you're thinking of, it's a good idea to sort of make a list of all the traumatic moments in the text. The death of Kiowa also is one of the most traumatic deaths for not only Tim O'Brien, but for the whole Alpha company. And if you haven't read of that story yet, it's also part of Norman Boker's post-traumatic stress disorder, but the death of Kiowa is something that haunts the men long after that event is over. And Tim O'Brien and Kiowa were he tells that, or he says that Kiowa was his best friend there. So Kiowa's loss is felt greatly by Tim O'Brien and the other soldiers. And we'll talk a little bit more about that, but the brutal way that he dies is very traumatic for the men. Rat Kiley. So we see Rat Kiley again at the very end of the narrative when it talks about what happens to him. So his transformation of character, we've already seen how he has lost his good friend Kurt Lemon, but we see the after effects of being a medic. He's like the first responder in stressful situations. So if a man gets shot or loses a limb, it's Rat Kiley who is there as the medic to take care of the situation. So he is sort of right in the midst of a lot of the blood and gore, and we see in Nightlife the effect that all that has on his mental health, and how his character sort of is transformed from this experience. And then finally, I want us to talk briefly about this whole idea of storytelling. Where does storytelling, how does that play a part of trauma narratives? Is storytelling a process of healing for soldiers who experienced, unspeakable horrors that we can't even imagine? So Tim O'Brien will repeatedly return to this idea of storytelling as being an important part of coming to terms with the realities of what happened, and hopefully healing, moving on, and keeping the dead alive in a way. All right, so we'll continue our discussion